dental health video for children with autism. Made possible by an unrestricted educational grant from Colgate, Sonicare, and Autism Speaks.
Autism is the fastest growing developmental disorder in the world. The latest statistics show that 1 in 110 children are on the autism spectrum. Autism affects social interaction, communication, repetitive behaviors, and is often accompanied by sensitivity to light, sound, or touch. Autism can make it difficult for a child to practice good oral health and can complicate things like routine dental visits. But by understanding a few key elements of the disorder, patients, educators, counselors, and dental professionals will be able to provide the skills necessary for good oral care that will benefit them throughout their lives.
Getting started at home.
The first step is to find a toothbrush and toothpaste that works for your child. Toothbrushes come in all shapes, colors, and sizes. It's important that you get an appropriate size for your child's mouth. Let your child pick out the brush. Just make sure that it has soft bristles. There are many flavors and styles of toothpaste. It's important to find a flavor your child likes. Colgate has many flavors to meet children's preferences with fluoride to fight tooth decay. Less is more when applying the toothpaste to the brush. Use a pea-sized amount placed in the center of the brush.
Proper parental brushing technique.
Here's a demonstration of the proper way for you to brush your child's teeth. Notice how Russ stands behind his son, putting Tommy's head against his chest. By standing behind your child, you'll be able to guide the toothbrush over your child's teeth. Just simply move the toothbrush back and forth 5 times. This motion should feel like you're brushing your own teeth.
All right, excellent. Good job.
If you're having a hard time getting your child into the bathroom, try brushing their teeth wherever they're most comfortable. One way to make the toothbrushing experience more enjoyable is to introduce your child to a power brush, like the Sonicare for kids. You should wait until after your child has mastered the use of the manual toothbrush and can handle the sensation of the bristles on their teeth. Start with the setting on low and gradually increase the power as they get more comfortable. The power brush has been clinically proven to be more effective than a manual toothbrush. The same proper parental brushing technique applies when using a power brush. Remember that the ultimate goal is for your child to brush independently. The best time to introduce flossing to your child is as soon as possible. Start off flossing with your child 1 tooth at a time, while also applying the proper parental technique. As with many self-help skills, the goal is for your child to transition into doing all the steps as independently as possible.
Finding the right dental office for your child.
Here are some helpful guidelines you should follow when looking for the right dental professionals. Ask if the dentist has a questionnaire about your child's habits and health issues that you can complete and discuss before the visit. If the dentist doesn't have a questionnaire, you can find one at autismspeaks.org. This should be filled out and returned before the visit. It's important that you speak with the dentist on the phone before you bring your child into the dentist office. On this call, you should tell the dentist what time of day would work best for your child and talk about any other challenges you anticipate your child may experience. Another helpful tip is to ask the dentist if they have any pictures of the office and staff, so your child can familiarize themselves with the new surroundings. For information about finding a special care dentist, please refer to the Autism Speaks resource guide available on the Autism Speaks website.
Simulating the dental visit at home is a great way for you to get your child ready for their first visit.
Some things you can do are: have your child practice reclining in a chair. See how wide and how long your child can hold their mouth open. This will help prepare them for when the dentist says, "Open wide." Place a small flashlight into your child's mouth. Use a plastic tooth mirror and rubber tip stimulator to practice counting teeth at home. Practice putting a dental x-ray in your mouth for a count of 3. Have the dentist send a prescription for no frequent snacks or sweets to be placed in your child's school record. If you think your child is going to get upset in the dental chair, you can also practice calming techniques, like asking them to count to 10 while holding their hands on their tummy, feet out straight. Simulating these simple steps at home will help get your child ready for their first visit.
What to expect when meeting the dentist for the first time.
The dentist or other office staff will greet your child in the waiting area with the ultimate goal of getting the child to sit in the dental chair. In some cases, this might take more than one visit, so don't be surprised if your child is more comfortable being examined in the waiting room. Bring a favorite toy. This will help give your child a safety net and will make them feel more relaxed. Always accompany your child. You might also want to bring a friend or family member. Extra help can make the visit more comfortable for your child and give you an assistant just in case your child needs behavioral guidance while at the office.
Advice from the dental experts.
In treating children with autism, you need total consistency, lots of TLC, and you need time to develop the relationship as you do with any other patient that you're treating in your office.
When I meet a child with autism, the first thing I try to do is establish a relationship with the child where I'm just their friend. I'm not Dr. Michelle, I'm just Michelle. I get down on their level, shake their hand, high five with them, make them feel that they can trust me.
Hi Tom, look who's here.
How are you?
You want to gently approach them. You want to see how they respond to what you do. You want to react to them without scaring them.
Really nice.
And progress slowly from the basics of moving them from one place to another after giving them a chance to get used to the office.
I'm so proud of you.
Good job!
Some simple things you can do are dim the lights, turn down loud noises, and keep the office neat and clean.
When treating children with autism, we often use a technique to desensitize them. They'll come in for multiple visits before we can actually get a full checkup visit done. And that's great. If we can have them come in one day and they just get them to sit in the chair and move the chair up and down and say, great, you did a great job, go home, goodbye. This is a way that gives them some confidence. They're less likely to be scared the next time they come in. And for us, it's great. It's a step in the right direction. Hey, Alexandra, we're gonna clean your teeth today. We've gone out to kids' in the car, we've checked their teeth. We've gone to their houses and checked their teeth. We've been to their schools and checked their teeth. If they're not comfortable coming in here, get the exam done somehow.
When you're treating children with autism, you really have to focus on the fine details of what you're doing. Sounds are critical. What sounds to you like something innocuous may sound like a locomotive approaching it at 90 miles an hour toward them. So you have to watch what you're doing and see how they react. Find things that work and go with it.
Give me your fingers. I'm going to show you how we count your teeth. Just like this. 1, 2, 3, 4, 5. We'll do the procedure on their hand. We'll show them what we're going to do beforehand. Open really big. We'll have them wear sunglasses to help them establish, if they're light sensitive. We'll turn on our instruments beforehand, let them touch them, let them feel them, let them hear them. It's okay? Okay. So that's how we clean your teeth. It's important for parents to bring their children to the dentist by the age of 1, as per the American Dental Association.
Parents will often think that just because children have baby teeth that they're of no consequence. Issues with these baby teeth can become life-threatening, and sometimes they're meant to work. They serve a function. They have to be taken care of. The parent may need education in terms of what not to feed the child, how to take care of the teeth. They're not born with this inherently.
For dental professionals who don't normally see children with autism, if you just take one child in and see if you can get through a cleaning with them, you'll see how rewarding it can be. And I'm sure after that, you'll be glad to take on more children with autism.
The nicest thing is when you finally are able to work with a kid and they know you and they come in and they give you big hugs and they become like any other patient. You've become part of their life.
Following these simple guidelines will help you have a great patient-doctor relationship. The goal is to get the child comfortable with the dental experience. Before you know it, your child will be well on their way to a life of good oral care and, most importantly, good oral health. Autism Speaks wants to thank Colgate and Philips-Sonicare for making this video possible. Because of their generosity, thousands of children on the autism spectrum will now have the proper dental care.